And so now we'll get started with Dr. Jarvis and Jeff for an update. Dr. Jarvis, the floor is yours.
Thank you, and again, I appreciate giving the opportunity to speak to the media in order to get important information out. So thank you for joining us this afternoon. I'll start off with a few numbers. Currently, Northern Light Health is taking care of 14 individuals who are confirmed to have COVID-19. Of those, 6 are hospitalized at Northern Light Eastern Maine Medical Center, 3 are hospitalized at Northern Light Mercy Hospital, and the remaining 5 are all being taken care of at home by our home care and hospice agencies. We've gotten into the habit of starting off these briefings trying to give some inspirational news about the community, our employees, and others who have been doing things to make a difference during this crisis, and I'd like to do the same today. I'd like to talk a little bit about our Caring Calls program, which is a free program coordinated through LifeSafe Emergency Response Service for those who might benefit from a daily call from a volunteer. Trained volunteers can make these calls each day to reach out to somebody in need, just to kind of go over what's going on in their life and to make sure that they're hearing a caring voice. This is especially important during this time when we're doing social distancing and some people are isolated from family, friends, and the community. Sometimes it's just nice to have somebody give you a call and just check in to see how you're doing and then offer advice if need be. These volunteers currently call about 81 people each morning, and so we are reaching out to the community. If anyone is interested in learning more about Caring Calls, please let us know. We'd be happy to connect you with these folks who are providing a tremendous service to our community. And with that, I'll turn it over to Jeff.
Hi, good afternoon, everyone. My name is Jeff Doran, as Andy had mentioned, and I am the Vice President for System Clinical Services here at Northern Light Health, and I've also been given the privilege to serve as Incident Commander for our COVID-19 response during this pandemic. I can't say how awe-inspiring it has been over the last 2 months to work with my colleagues, actually thousands of them across the system, as we've planned and prepared and responded to this unbelievable time in our life. It's been really awe-inspiring to see the dedication and commitment by our staff, frontline staff, as well as thousands of behind-the-scenes folks who are helping to support our frontline efforts. So it's been my privilege to do that, and I look forward to continuing to support us. And now the next stage of this, I think, as you guys had discussed at the last week's briefing, we're beginning to turn our attention, in addition to maintaining diligence in our recovery and planning and responses, we're turning our attention to the resumption of services. But resumption of services in a post-COVID world, we know it's not going to be the same. It will be different. And as a result, we've put together a very comprehensive plan across the system designed to ensure that we do this in the most safe manner possible and putting in place all of the appropriate measures. We've created what we call our PATHS teams. These are patient access to healthcare safely teams, where we've created a number of member organization teams to help develop the appropriate protocols, and we're carefully choreographing all of the different safety measures that'll be necessary. We're very fortunate to have the expertise in our system of our infection disease and infection prevention staff to help guide us. And so we will be focusing in on all of the different components and workflows that go into that. We've all seen evidence now in our communities as they've begun to slowly resume, and that will be the case in our standpoint. We will be getting our guidance from our federal and state CDC and other clinical entities to ensure we do this in the most safe fashion. So we will be focusing in on such things as testing expansion and integration of that testing into our daily workflows and the criteria surrounding that. We're also deeply focused on our PPE, our personal protective equipment. I think we've all appreciated the challenging experiences we've had across the country in that, and so we have to carefully align our PPE availability and usage, particularly as we begin to slowly expand our clinical services, as well as our testing capabilities. We also know that we've had challenges in securing an abundance of testing supplies and kits, et cetera. So it's a carefully orchestrated series of efforts, but we will look forward to introducing in a phased fashion across our system, from ambulatory to the invasive procedures, et cetera, in a very measured way, with protocols that we're going to be sure that our patients are well aware of and hopefully feel extreme comfort. We've been very fortunate up to this point to have very limited staff exposures and positive results. That's a very reassuring thing for us, and we believe we can continue to support that same type of environment for all of our patients once we resume services.
Jeff shared quite a lot of information about keeping patients safe and how that is the most important consideration as we begin the process of resuming procedures and tests that may have been delayed or postponed. And we will continue to analyze and look at each case independently for appropriateness to bring patients in safely to our facilities. I know we've covered this before, but I just wanted to reiterate that we are asking that all visitors and patients to our facilities wear face coverings when they enter our facilities. That is important because that helps to keep the patients safe and helps to keep our staff safe as well. And frankly, it's what we should be doing out in the community. It is the way that we can help limit the spread so that we can get back to whatever normal will be in the future. We're also requiring all of our staff, whether they are clinical or non-clinical areas, to wear face masks during their duties and interacting with our patients and their families. I want to remind people that if you need care, you should seek care out. This is not the time to avoid facilities when you have a chronic disease that needs attention or an acute illness. And especially if you have an emergent condition, please call 911 for emergency services. And then for other conditions, reach out to your healthcare provider. We are here ready and able to see you, and will see you if necessary. I did want to mention that there was a little bit of chatter in the media over the weekend about some issues with the COVID-19 tests that we perform, and that there may be some contamination. I want to assure people that is not the case. The COVID-19 tests that not only Northern Light Health is utilizing, but that utilized across the country, are safe. There was some issue initially while the CDC was developing testing where there was some contamination at their lab. That is not the product that we're talking about that's shared out in our communities, and did not affect the test kit that actually does the swab to collect the specimen. So there is no fear that you can contract the virus from getting a test, and I just wanted to make that clear. And finally, I just wanted to say that we have a new support tool on our website that can help people determine if they need care and if testing is appropriate for them. It's very easy to use, and if you just check out our website at northernlighthealth.org, you can see the resource there. And with that, we'll open it up for questions.
Okay, I'll call on each media organization and then unmute you. You'll have a chance to ask 2 questions. If you'd like to direct your question to a specific person, please let us know. Otherwise, whoever is the best person to answer that question will jump in and answer it. So the order today will be WABI, Ellsworth American, News Center, WVII, Scott Bay Press, WERU, Bangor Daily News, and WGME. So we'll begin with WABI. Morgan, the floor is yours.
Hi there. My question is about people who are brought to the emergency room with non-COVID-19 related symptoms. We've heard some reports that the family members have brought their family member in for non-symptoms, to then have medical staff come in and say that they are being admitted and that they are going into lockdown. And this is happening without any coronavirus testing being done.
So thanks, Morgan. So the question was, are patients who are entering into our facilities thinking that they're coming for non-COVID related reasons, and then being either re-identified or identified as possibly having COVID-19, and then putting in restrictions because of that? And so it is true that sometimes people do reach out to us with symptoms that are not suggestive of COVID initially, but then other instances or details emerge that make us feel that COVID may be a consideration, I will tell you that actually we screen all patients coming into any of our healthcare facilities for the possibility that they may have an infectious agent that requires us to do further precautions to protect both our staff and the other patients in the area. And so working with COVID is no different than that. However, the level of personal protective equipment that both the patient and the staff members need to use is a little bit higher than most people are expecting to see. And it could very well be that someone comes in with one particular situation, but then during either screening questions, testing, or imaging studies, the suspicion for COVID-19 comes up. And therefore, we must take all of the precautions we can to ensure the safety of both that particular patient, their family, as well as our own staff and the other patients and families that are in the facility.
And would this lead to an immediate sedation and then put on a ventilator or intubated in the emergency room?
No, that would not be the case. We didn't, the decision to make to put somebody onto a ventilator or something along those lines is made on a clinical condition and a clinical basis, and there is no evidence that putting somebody on a ventilator as a preventative measure, even if they have COVID-19, is an effective treatment. In fact, it's the opposite of that. We try to avoid using ventilators if at all possible, but obviously there are some individuals who are sick enough that would require a ventilator, and that again is a clinical decision.
All right, next we have Ellsworth American, Kate Koff.
Thank you so much. So 2 questions. The first is fairly succinct. I'm wondering, you talked about testing expansion to kind of fully, obviously, I guess, to kind of fully reopen all of the facilities. And I'm wondering if you can tell us if there is a threshold, a certain number of tests that you would want to do per week or per day to kind of fully reopen all of your facilities.
Yeah, that's a very good question. And, if we were to look at life before we had this pandemic, we know across the system we have well north of 15,000 patient encounters a day between ambulatory practices, emergency department visits, elective surgeries and procedures, et cetera. That's a tremendous number. We also know that testing is not necessarily indicated for all of those kinds of encounters if effective, safe precautions can be maintained. As a result, we are following the federal and state guidelines surrounding the prioritization of our patients. And of course, those that are medically necessary, those that are time sensitive, some of those patients who have had deferred or delayed care that are beginning to get progressively worse and risking their situation. So there's not an exact number, but we do know that we don't have a sufficient amount of testing availability at the moment. We are actively and aggressively pursuing all strategies to secure more testing, and we will use the guidelines, the infection prevention guidelines that have been well publicized to serve as our guide, and that's what we will employ across the system. And as we get more and more capacity of testing, we'll be able to introduce more and more testing, not only for our patients, but we're also going to be looking for testing of our staff as well, just to ensure we're keeping good tabs on their health and well-being as well.
Sure. Thank you. And then my second question is sort of related to looking forward into the future. I'm wondering if both of you might want to talk about maybe some of the most valuable lessons you've learned as an organization at this point, and what changes you might make either in relation to an infectious disease protocol or otherwise, kind of once this has started to die down a bit.
I can start from an administrative perspective, and I'll let Dr. Jarvis discuss some of the clinical perspectives. This crisis has really brought out the best in what Northern Lights staff is capable of stepping up to. We all know that healthcare workers always seem to respond when the chips are down. This has been a remarkable response across our system and at all levels. And so we've been extremely proud of that work. What we also learned is that the value of a structured approach and response approach through our incident command structure has been exceptionally important in ensuring that we're doing things in a coordinated, comprehensive manner. So that has been extremely helpful, and as we tackle these things going forward, we are more than likely to reinstitute the kind of integrated and comprehensive incident command structures that we typically practice anyways, but this was on a much more extended and prolonged basis. We also learned the value of communication and the importance of communication. There's all kinds of opportunities to misconstrue information and messaging, and it's very difficult. We've learned that it's not easy to establish a uniform, consistent message, and so we work extra hard on that, even though we don't always get it right. We know that we have more work to do on that. We've also seen remarkable generosity across our system, where we viewed this as a team effort. We found during this response period, we have members across the system who have volunteered willingly to support, whether it be staff or equipment, wherever necessary to help an area that might be in greater need. So we've brought out the very best in our staff in sort of their philosophy and their support of each other.
Yeah, thanks, Jeff. I'd just like to add from a clinical standpoint, lessons learned is preparedness can never be enough. So being prepared across the spectrum for a crisis like this, it needs to be taken seriously not only at our local community hospitals, our big systems across the state government, and across the country itself, is that we need to be prepared for when epidemics do occur. It's painfully clear that we were staffed in terms of things like personal protective equipment, the feasibility of being able to discuss in a clear and cogent manner what this disease can cause and how to prevent it, and more importantly, how to treat it at this time. One of the things that as Jeff highlighted, communication has been key for us. Northern Light Health has worked with other health systems across the state, as well as the state CDC, on a number of endeavors, sharing information and being prepared. And then listening to experts. That is one of the things that I think is most critical and most important when we're talking about how we can get through this and come out on a bright side on the other side of this crisis. Understanding the science behind things, listening to our scientists, our epidemiologists, our physicians, and other healthcare providers in their knowledge and understanding. I am very appreciative that Northern Light Health has given me the opportunity to kind of suspend some of the other work that I have been working on in order to focus on this particular subject and to work with Jeff on our incident command. It was important that because I can get information gathered in a short amount of time and get it out to our healthcare providers when they needed it. So I think those are major lessons that we will carry forward and continue to be prepared in the future.
I'm going to add one more point. We've also learned the value of community partnerships. Throughout this, all of our members in all of their respective markets, and again, we cover a very large geography from in the state of Maine. We've had tremendous collaboration with our community partners that has really enabled us to together sort out, learn, figure out, work through coordinated strategies on how we're going to care for this as an entire community and communities. So that has been remarkably gratifying to see the kind of collaboration that we've experienced during this pandemic.
We have about 10 minutes left, folks, and I want to make sure that everyone has a chance to ask a question. So we'll give everyone one question for now, and then any remaining time we have, we'll go back and get through as many additional questions as we can. And so with that, News Center Maine is up next. Bob, I see that you've joined the call. Do you have a question?
Well, hi there. Yes. It was announced on last week about the incidents at the Hope House. Dr. Jarvis, you know how those people are being quarantined, what the situation is, and how they go about that?
So the question was, what are they doing for isolation for those individuals who tested positive at Hope House? We're fortunate because there are, I believe, 2 hotels within the Bangor area that has allowed for that to occur. I do know that there is efforts being made by Penobscot Community Health Centers, who runs the Hope House, to make sure that they are checking in on those individuals and taking care of them. Specifics I don't have, though.
Okay. But are they required to stay? Do you know that?
I do not. That would be a state decision.
Okay, next we have ABC 7 Fox 22. TJ, you're up.
Good afternoon, thank you. Mr. Duran, you mentioned that you're going to start phasing in some testing and other ambulatory procedures.
Yeah.
Can you specify what are some things may roll out?
Well, certainly we're prioritizing those patients who are really medically necessary and time sensitive for procedures. Those are the very first ones out. We also, though, as I mentioned and alluded to, there's opportunities to reintroduce some of those services that might not require any advanced testing, rather appropriate adherence to good safety measures that we, again, experience in our communities when we go to the Home Depots, et cetera. So those can be things in the ambulatory setting. They can be some therapies, et cetera, that could lend themselves to that. So as we begin to sort of see our way through these measures that we're now putting into place in all of our different facilities and members, and again, remember, we are probably over 150 sites of care across the state, and not every physical plant and layout is exactly the same, so we need to be mindful of that, but we lay in over all of that the appropriate guidance to ensure that all of the social distancing, all of the staff and patient protections and screenings are all in place. We're going to find increasingly more opportunity to be able to reintroduce that into the equation.
Okay, next we have Penobscot Bay Press. Leslie.
Hi. I'm not sure who to address this to, but I think last week DARPA announced that there's a team of scientists that are working on a new test. They're submitting it to the FDA this week. That they say it would be a game changer because it would be able to tell whether someone has a disease before they become infectious. And I wondered if you had heard of this and whether you thought it was a game changer.
So thank you for the question. The question was that there's talk about DARPA creating a test that may be able to indicate if someone was infected with COVID-19 prior to them being infectious, meaning being able to pass the disease on to somebody else. I don't have any specifics on that whatsoever, but I caution us when we use the word game changer. We have heard that name or that term used multiple times since February, when this virus all started to show its major effects across the country, and unfortunately many of them have not panned out. While I'm hopefully optimistic that we will develop testing that is adequate to meet our needs, as well as validated to have some clinical relevance. Similarly with treatments and with a vaccine, we need to do all of those things cautiously and wait for things to have gone through the regulatory process that needs to happen so that we know things are safe, accurate, and have utility. So thank you for the question.
Next we have WERU, Amy Brown, you're up.
Hi, thank you. I think this question is for Dr. Jarvis. I'm sure you've noticed out in the community there are people now who are thinking that they're being patriotic by not wearing masks, ignoring the social distancing, gathering together in groups. On a recent CDC briefing, people in the comment section were advising each other, you don't need to wear a mask. Just tell them at the grocery store that you have a pre-existing condition and you can't wear one, they can't check. So there's actually a movement of people who are encouraging each other to ignore these things. I'm wondering if, as a healthcare facility, A, you're dealing with people coming in that you're having a hard time convincing to put on face coverings, and B, if there's anything that you can say as a healthcare organization to build on the goodwill people have had for healthcare providers to get the message out of the importance of following these guidances from the governor, the orders from the governor?
Excellent question. So the question was about people who right now are defying the governor's recommendations and frank order to wear face coverings and to limit gatherings to less than 10 individuals. And so since we started doing these briefings, we have always said we would put science and clinical relevance ahead of any other part of the story or discussion that we've had, and I continue to do that. It is imperative that we heed the governor's caution and that we watch her and follow her advice. So face coverings are important. If you feel that it's not something that's important to you, think about the other members of your family, the other members of our community. When we wear face coverings, what we are doing is protecting other individuals, and that's the important thing. Think about it as protecting your grandmother. Think about it as protecting your sister with cancer. Think about it as protecting your child who has a chronic medical condition where this virus could be deadly, and that's the importance of it. Similarly, when we've looked at the past, and the best example we have is the flu outbreak that happened in 1918, 1919, when people started to gather again after having social distancing and masking orders in place, they had a second rise in that virus that killed many more people. That's what we are trying to avoid, and that's why heeding this warning is important. If you think it's patriotic to not wear a face covering, think about this. Is it patriotic to put your fellow members of your community at risk? And I have to say the answer is no. And I know I sound a little bit more passionate when I talk about this now, but it is my job for this institution and for my community to keep everyone safe. And the single best way we can do that is to practice those things that we have talked about over and over again. Stay home if you can, only traveling if necessary. Washing your hands on a regular basis or using hand sanitizer, practicing good social distancing, and if you go out in public, to wear a face covering. The second question was about have we had difficulty in people following those rules when coming to our facilities, and we have not. In fact, it is just the opposite. Most people come into our facilities thanking us for the work that we do, for wearing our face masks to protect them, and for them wearing face masks or face coverings in order to protect us so that we can continue to do our job. And I implore all of your viewership and readership to do the same. Thank you for asking that very important question.
All right, next we have Bangor Daily News. Charlie had a question that he put in the chat, and I'll read it. His question is, can Jeff or Dr. Jarvis discuss what mental health challenges have been emerging at Northern Light facilities as a result of the coronavirus? Specifically, what types of mental health issues are patients experiencing when they seek care at Northern Light Health?
I think it is there's the stress and worry and concern of the unknown. So when you enter into our facility, it's the fear when you start seeing people, particularly our employees, all wearing masks. That's obviously not the way we had healthcare just 3 months ago. And so I think there's that anxiety-provoking event. And then it's the fear of, if I had this disease, what could happen to me or my family? I think that we have done a good job in trying to educate the population in general and those who have been infected with the disease in particular. From our own staff standpoint, we have provided resources for our staff to seek out mental health experts and give them the care and advice that they need, because we're all people, and so all people share the same kind of emotion and feeling when they're under stress, and so providing that assistance. And then we provide that same assistance for our patients. Without getting into specific details, I have spoken to several of my patients on the phone, addressed their fears and their concerns, and again, the reason why we agreed to do these press briefings was to help to calm the public, inform the public, and try to decrease their anxiety.
And then maybe one last perspective. For the same reasons that you've described or aware of the anxiety that is occurring in patients, please be reassured. We have done a spectacular job over the last 2 months protecting our own staff. We will hold no bounds to continue to do the same for our patients. So I would feel that it's a very confident statement that we are providing as safe an environment as there possibly can, and we will continue that commitment for our patients.
All right, final question of the day is from Brad Rogers, WGME. Brad, the floor is yours.
Hi, can you hear me okay?
Yep.
Okay. She asked the one question I wanted to ask, but I'm curious. You mentioned you had 15,000 patient encounters a day beforehand. What was it? What was the count during the pandemic? How were the finances at the hospitals? And I'm not sure if you laid anybody off or not, but if so, are you planning to bring them all back fairly soon?
So those are very deep questions, of course, complicated questions. But no, we have not laid anyone off. We've offered, as we've mentioned in the media, voluntary furloughs because we felt such a commitment to our people. And we have had a fair number of folks who have availed themselves of that. We also, though, know that we have struggled considerably with our volume declines. We've experienced upwards to 50 to 70%, depending upon what area, decline in volume, and of course we know that has significant revenue implications. We're very thankful that the federal government has developed some of these programs that we've accessed, along with all of our other healthcare systems around the country, in an effort to help us get through this tough time. A combination of grants, although modest amounts, but as well as advanced payments and other plans. We are availing ourselves of all of that because we do worry about what life will be like following this whole virus on a go-forward basis. We're excited about some of the changes that we know are going to occur surrounding things like the use of televideo and telehealth. That's a fabulous development and an accelerated development for accessing care. We love that idea. We're going to continue to support that in major ways. But we also know the finances are really at the underpinning of our ability to maintain our operations. So we're going to work hard. We've got a lot of work ahead of us. This is not going to be an overnight type of thing, but we've got a lot of work to do, ground to make up, and we're going to do this as we've done this so far. We're going to do it together.
All right, thank you, Jeff. That wraps up our media availability for today. As I mentioned before, we will share the clean audio video file with you in about an hour or so, hour and a half after this is done. I'll email it to you. And be on the lookout for our next media avail, which will likely be Wednesday or Friday this week. So thank you for helping us spread the word, and have a great day, everyone.
Thank you, everybody.
Thank you.